So let's talk about abdominal breathing. The diaphragm divides your body in half between the chest cavity and the contents of the abdominal cavity. It's more like a sort of open parachute shape because it attaches to the ribs at the front and then round and then at the back. So at the highest point it actually comes up to your breastbone there. It comes down with your rib cage and then goes all the way around, attaches to the ribs at the back. So think of it as coming up like this in the centre. It wants to contract and pull itself downwards, but in order to do that it needs to have space to come down. That's where the abdominals come in. If the abdominals are relaxed, they're not pulled in really tight and held onto, then the diaphragm has room to do what it wants to do. You don't have to consciously control it. In fact, you can't consciously control it. But what you can do is relax the abdominals and allow that air to get pulled in. So this is how you can practice feeling this at work. Start with an out breath. Focus on pulling your belly button towards your spine. So that will allow you to pull this whole area in here. And as you're doing that, you'll feel that you can get as much air as possible blowing out of the lungs. Be careful that you don't collapse as you're trying to push more air out. That's not going to help. And then when you've completely exhausted the lungs of air, make sure that you relax everywhere that you've been working here, and automatically you'll feel air get pulled into your body as the diaphragm does what it naturally wants to do. So you start with an out breath. So obviously that's quite an extreme version of how to do it. You can really see the belly relaxing and coming out there. Obviously when you're getting into actually singing something, you're not necessarily going to let it go that much. But in the beginning it's really important to practice fully letting those muscles go so that you can feel that air rushing back in. So that's a quick way to practice abdominal breathing.